I'm Sophie.
I'm Gina.
I'm Sarah.
I'm Ashley.
I'm Haley.
My name's Melissa.
And I'm Leah. We're all occupational therapy students, and occupational therapy is a field that works with people from birth to death. We can work with them in all sorts of aspects of their life to help maintain what they have or strengthen any loss that they may have. This can include bathing, dressing, sexuality, mental health, and so much more.
ADLs are activities of daily living that are crucial for a person's every day-to-day life. These could be tasks such as brushing your hair, eating, toileting, or even bathing.
Ashley, what are compensatory strategies and how can they help with ALS?
By teaching compensation strategies such as splinting, this can help individuals with ALS maintain their functionality and independence as long as possible. Maintaining functionality is crucial for the psychosocial impact on an individual as it allows a person with ALS to maintain function within their daily lives. Psychosocial factors refer to how physical and mental health impact overall well-being and functionality. How does this impact caregivers?
So by teaching compensatory strategies to individuals with ALS, it allows those caregivers to really focus in on the skills that the person with ALS really needs help with and can't do on their own. So this allows a decrease in burnout with those caregivers as they can really maintain and focus in on those skills that they need.
Hey Haley, how are you feeling today?
Hi Gina, I'm okay, but I'm feeling a little down because I can't do the things I used to do anymore.
Well, diseases like ALS can prevent you from doing those things that you used to like to do. So, what's an activity you would like to work on?
I'd really love to be able to make breakfast again.
We can work on that.
There are many techniques that an individual could employ to compensate for weakness throughout ADLs. In the context of splinting, one compensatory strategy for weakness is positioning oneself in a seated position with elbows on the table versus a standing position. This technique can allow for energy conservation, so splinting should be performed in a similar way that conserves the most amount of energy for the patient. The patient could employ this strategy while brushing teeth, dressing, eating, or drinking. He or she will be able to prioritize ADLs and other occupations that require more energy output. For assistance in ADLs, it is key to prepare the room before beginning the ADL task at hand. OTs can teach patients how to prepare their environments to simplify tasks. For example, when dressing, clothing items and shoes should be laid flat on the bed or floor, and all assistive devices should be within reaching distance. The patient should sit down instead of standing to pull on pants, which can also help conserve energy. If an individual can take the time to prepare and plan for the activity, the work is simplified, and energy can be conserved for a more difficult task later on. Another technique that can be used for splinting is the protection principle. An example of this could be when the patient uses a cart to carry larger items or uses devices to assist in ADLs. They can also change their positions frequently. When a patient is able to protect their affected body part, the individual is able to have stronger, more healthy joints assist in the workload, which allows for a more beneficial healing process while in the splint.
Adaptive equipment are tools that one can use to complete ADLs by improving or maintaining function through energy conservation and compensation techniques. Splints are an example of adaptive equipment that people with ALS can use to promote function when completing ADLs. Splints also help prevent caregiver burnout.
There are several general things to remember when using a splint. Make sure the splint is well fitted. A splint that is not fit properly can move, causing friction. This can result in discomfort or damage to the skin. Monitor the area for any condition such as a rash, broken skin, or swelling. This might indicate a need to wait to wear the splint until the issue has resolved. When wearing a splint for the first time, start with shorter intervals and check for pain or skin irritation.
Neutral wrist splints are beneficial to use when you have weakness in your wrist causing it to drop. This muscle weakness in the wrist can make it hard to complete ADLs. Neutral wrist splints provide support to help with completion of ADLs. An example of this is brushing your hair while using a neutral wrist splint to support the wrist.
Resting splints are used for wrist and hand support while an individual is resting or sleeping. Resting hand splints, in combination with exercises, have been associated with preventing stiffness and tightening muscles that can lead to contractures. Contractures can occur when a person's muscles are kept in a tight position for a long length of time. Contractures can cause pain and deformities, and decrease range of motion. Resting splints can reduce this pain by maintaining a neutral position in the hand and wrist and stretching the muscles of a person's wrist and hand. If the splint is uncomfortable at first, individuals can try wearing it for shorter periods of time and gradually increase the amount of time it's worn to adjust to it.
If weakness in your hand is causing difficulty holding things, such as your toothbrush or a spoon, a universal cuff might be a useful tool. Universal cuffs can slide over your hand and provide a secure attachment for tools. Universal cuffs can also be made to easily attach with a splint. A cuff can come with a utensil or pin already attached, or they can be made with a universal attachment that allows tools to be switched out.
Please consult with your physician and occupational or physical therapist before using any techniques discussed today, as well as buying or using any medical equipment to avoid injury and ensure safe use and techniques. Thanks for watching our video.